Hi, I'm Dr. Houston Butchko, and I'm one of the providers with the Legacy Dental Group. And the first thing I want to cover is what is the purpose of a night guard? And to that I'd say a night guard is a preventative device that we typically recommend to those who have worn natural tooth structure or worn dental restorations. Night guards are typically something we'd recommend to most adult patients, anyone that has the capability and ability to grind and wear down their natural tooth structure or previous dental restorations. So night guards are typically recommended during a clinical routine examination when you come to visit us. Usually the provider will see history of worn dental restorations, worn natural tooth structure, and it usually prompts a conversation to talk about how can we prevent the further loss of any more natural tooth structure. Another reason why we might recommend a night guard typically comes from a patient who has a history of, hey, I woke up and my jaw is really sore. I sometimes get headaches. Sometimes people have a difficulty with cracking or clenching of the jaw in the morning. And sometimes it's, hey, it takes a little bit of stretching in the morning. Sometimes that's another reason why we might recommend a night guard. And we notice some of the after effects of those clinical presentations of grinding, clenching, posturing your teeth, thus seeing some of the damage that comes with that. Sometimes if you have a significant other or a partner who notices that you're clenching or grinding your teeth at night, that can be another reason that you might not even know of. It just takes someone else making comment of it. So once we've decided that a night guard is best for you, the patient, we will talk about how we fabricate the night guard. Here in our office, we focus on digital dentistry and the ability for us to take intraoral scans of your mouth. This is the new replacement for previously analog or alginate impressions. We take a digital impression of your jaw, the way that you bite, and then we put you into a specific position to help rest the jaw joint as well as rest the jaw muscles. That in all its entirety helps us get the best fitting night guard for you, thus we're getting the best preventative care for you. Another reason we like to focus on digital dentistry here at Legacy Dental is that we have the ability to make you, the patient, more comfortable during the information gathering process. And if for whatever reason, the night guard breaks, your dog eats it, or anything out of the ordinary, we have the saved file. Therefore, we don't have to retake a lot of the information gathering. We'll be able to order you a new one, as well as just get you off and running quicker. So one of the commonly asked questions we get when talking about night guards is, how does it differ from my retainer? I've worn a retainer for years. Why do I need to wear a night guard now? The retainer typically is a flexible product that you get, whether that's after getting braces, going through Invisalign, straightening your teeth. The difference between a retainer and a traditional night guard is that of strength and rigidity. The material itself it's a clear resin-based material. The night guard is hard, the night guard doesn't flex, and the night guard helps create a space between your upper and your lower jaw to prevent the forming of clenching, grinding, posturing, any excess force being placed onto your teeth. The night guard is there to help, once again, prevent any further damage to natural tooth structure as well as dental restorations. Another commonly asked question is, does my insurance cover getting a night guard? And to that, I usually answer to patients, it depends. And most insurances will cover a portion of your night guard due to its preventative nature, but ultimately it's individual to the plan, and we always encourage patients to reach out to us if you have any questions or need help navigating your insurance and your insurance benefits. The last topic I wanted to talk to you guys about is how to take care of your night guard. Ultimately, wearing your night guard is the best thing for you. That's why we're recommending it. In order to keep it for the longest amount of time, we always encourage cleaning it. Oftentimes, you can use denture cleaner or denture tablets. More often than not, it's just making sure that you're keeping up with any excess plaque or anything that might be getting into your night guard. If you maybe missed something when you were brushing, it's just ultimately how good can we keep up with it? I tell patients every day, the night guard will take good care of you if you take good care of it. And over time, these things, we always encourage patients to bring their night guards into their visits. And if we ever need to replace anything, make adjustments to anything, those are always best suited at routine care exams. Once again, thank you guys for tagging along, and I appreciate your time, as well as if you ever have any questions or concerns, please feel free to give us a call.